Good evening, viewers. Welcome to Hornbill TV. My name is Paulami. Today we have invited a guest with us. He is none other than Professor Dr. Subhash Khanna, the man with the magical healing hands, who is also known for bringing many newer techniques to Northeast for the first time. Sir, how are you?
I'm doing good. Thank you very much, Paulami, for inviting me to this program of Hornbill. This is the first time I'm appearing for your TV, for your channel, and I'm really thankful to you for your invitation.
Thank you so much, sir. Even I am very privileged to have you, sitting in front of you today. So, our viewers would like to know a few things about Swagat Hospital and you. Tell us something about Swagat Hospital and the birth.
I'm Professor Dr. Subhash Khanna. I'm the past president of Indian Endosurgical Society, and presently I'm the founding president of Association of Robotic and Innovative Surgeons of India. I had been working in medical college for 17, 18 years till 2000 when I thought of leaving the college and you can say I'm a surgeon entrepreneur starting something of our own. And that's how we conceptualized that the patients who go out of Northeast are either surgical or cardiac or cancer patients. So these were the three needs that time in 2000 when we conceptualized this. So 2000 we started with a small center. Our ready-made hotel was converted into a hospital, 40 bedded, and in 2015 the first super specialty hospital of the Northeast in Guwahati was born. That is a Swagat super specialty hospital. Initially we thought it to be surgical. Later on we thought that people for heart disease also need us, people for urological, for ENT, for plastic surgery, for all other specialties they need us, and that's how we expanded. And that's about Swagat. Swagat is a 100-bedded specialty hospital in Maligaon, Guwahati, and one of the first super specialty hospital having almost all the specialties starting from onco, cardiac, to urology, to thoracic surgery. But then our main focus is always surgery. Although we have a big ICU, 25 bedded, and 24 hours the team is ready for any accident, any trauma cases to help them whenever there's a need.
Swagat Hospital is involved in bringing many new techniques. So, sir, how would you elaborate it?
Yes, the technologies and the techniques, all the newer procedures normally go to the mega cities or to the developed world. It should be our endeavor to bring techniques, technologies, and treatment facilities to the remotest corner of the country. In 92 we started laparoscopic keyhole surgery. Later on we started in ERCP, by which I can go into the liver and can take out a stone. That was the first time we started in 1996. In between, in 1995 we started laparoscopic hernia surgery, or 94, 95, around that time. And then we started couple of years later we involved into cholangioscopy, spy cholangioscopy. Even now there were only 2-3 centers, I think 2 centers apart from ours. There's only one center which is doing. So in that What we do, like we do endoscopy for the stomach, endoscopy for the colon. I can do endoscopy of the liver. I can go into the liver and look inside the liver and take out a biopsy from there, or I can break a stone from the liver. I means any person who is doing a spiroangioscopy. That was one. In between, we also did first few cases of single hole surgery. We call it SILS surgery, where normally when we operate, we have a one hole for a camera, two holes for the instruments. In single hole, we everything is near one side, so we make all the holes there, and we go inside and remove a diseased organ, or we remove the stones. So that's called SILS surgery. Thereafter, we started working on thyroid glands. Big people used to cut. We thought, why not we do from the chest or the axilla, and we started removing endoscopically thyroid glands. We started even removing the tumors from the breast endoscopically without making a scar. I can go from the axilla and we can remove a tumor and come out. People will not know why surgery has been done. So those are the new things which we developed, and the very latest thing is the bringing the robotic surgery to the Northeast about in about three and a half years back, and we'll be talking about robotic surgery in course of time.
Would like to know what is the speciality of Swagat Hospital and what are the special treatments which are available in the hospital?
Swagat is a multi-specialty hospital. We focus on surgical disciplines mostly, but we also have very strong emergency care backup and ICU backup. So we specialize in endoscopic surgery or laparoscopic surgery. We have robotic surgery. We have a strong urology department, orthopedic department, neurosurgery department. Around the clock, there are 2 or 3 neurosurgeons which are available, and there are times within the patient has reported in half an hour he is taken to the operation theater to save his life. So we also have a very strong cardiology department now with a IR facility. In intervention radiology facility, you can go inside liver, brain, any part, any organ, and can treat a lesion, or can also stop bleeding from these organs, or can open up a blocked vessel there. So this is a new thing, and we also have very strong radiology department. We have in-house CT, we have in-house MRI, and the ICU is strong because my son. My second son is an intensivist, Dr. Khanna. He looks after the ICU, and there's of course a big team of doctors there, and the ENT team is very strong. Head and neck team is very strong. My wife, Professor Khanna, who was heading the ENT department at Guwahati Medical College, is there, so she looks after the ENT department along with a team of another 4-5 surgeons with her.
I would like to ask Khanna sir about how the robotic surgery works.
People have a very different notion about robot. What we see in movies is the robot is like a metallic a humanoid structure which comes and kills the enemies, having looks like a human being. It is not. A surgical robot is totally different. It's a machine between me and my patient. It's a machine which I can maneuver. We do not have autonomous robot which will do surgery on its own. It's all being done by me, as a surgeon. So what happens the moment I want to use a robo takes up most of my work, and I have to manipulate the robo. Now what happens in robotic surgery? This is one type of robo which we have it. This is the first one in Northeast India at present, and we have done nearly 400 robotic surgeries by now. Now these are the instruments we use in laparoscopic surgery, and we make the holes, and now everything, all the arms, the wrist, everything we connect, and now the whole thing comes to the surgical console in my hand. Now I'll be sitting here, and the stitching, suturing, dissection which is being done inside are with the help of my surgeon console. I am not near the patient, so I have made the hole, connected it to my surgical console, and now the robo is between me and the patient, I'm operating sitting on the console. My all tremors are gone. My nothing will be seen inside. It will be very fine, and I can do extra movements also. So a surgical robot is an electromagnetic device which is between the patient and the surgeon, which enhances some of the movements of the surgeon and makes surgery easier, better, safer.
Our viewers would also like to know, sir, what are the surgeries possible today with robots? Can you please tell us?
When we started robotic surgery, when the surgical robot got an FDA approved in 2020 years back, basically it was introduced for urology. The cancer of the prostate is now one of the best treatment with the robo. So, and thereafter, the surgeons started doing most of the cancer work with robo. So in the West today, almost all the colon cancers are done robotically. In India also it has picked up now. So the first indication, I say, most of the advanced urological procedures, when you want to save the kidney and remove one pole of the kidney, most of the advanced cancers, whether the cancer in the food pipe or cancer in the colon or the stomach. And thereafter, the general surgeons, we do many procedures starting from hernias to the gallstone surgeries, to the liver stones, to emergency surgeries, to upper gut surgeries, fundoplications for GERD. So in general surgery, it is routinely used. In hernia surgery, it is now being used very frequently. And it's now moving to the gynae is the next procedure. The gynecological surgery, basically the removal of the uterine ovarian tumors, the removal of the uterus, are all done much more conveniently and comfortably and safely with the robo than with laparoscope or open surgery. Apart from this, there is a strong indication coming up that's a robotic surgery for the head and neck, robotic surgery for the spine, robotic surgery for the bone, and the one of the popular surgery which is there is robotic surgery of the transoral robotic surgery, thyroid robotic surgery. So transoral, inside the mouth, on the base of the tongue, posteriorly behind, if there is something, you have to cut the jaw to reach there. A robot can enter inside the mouth and I can operate sitting from outside. I can remove the tumor. So those are the new indications, plus thorax. If I have to open up the thorax to remove a small tumor, I'll have to open up the chest or cut the ribs and go inside. So thorax and cardiac surgery. In the thorax, we are doing esophagus surgery, surgery for cancer, esophagus, and the lung. Cardiac, we are not doing. There are only 1 or 2 centers in the country which are doing where the heart surgery can be done robotically, very precisely. So thorax is one indication where robot can work marvelous. So these are some of the indications where robot is being used today.
In what way the robotic surgery is beneficial to the patient?
When we are doing open surgery, opening up the chest or the abdomen or any organ, we used to think after opening also we can look inside and operate comfortably. We started doing keyhole surgery, but when in keyhole surgery, I do surgery on the left, my hand moves to the right, and I have to operate on a flat screen. So from a view of 3D, 4D, where I can see around the abdomen, around the thorax, we are limiting ourselves to operating on this flat screen, 2D. With a robot, I can operate, a surgeon can operate on a 3D view. So you can see a 3-dimension. When you look inside with the camera, it appears as if you are operating in a cavity. Directly the cavity is seen. So that makes surgery very comfortable. All instruments are either in my hand control, in the foot control, depending on what type of robo I'm using. So the benefit to the patient is we have seen that in keyhole surgery also patient gets pain. In robotic surgery, the pain score is very, very less. Patient recovery is much faster. The reason of patients recovering faster and less bleeding is the precise dissection. If I have to reach from here, from upper abdomen into the pelvis, my robo can go in and then I don't have to do any movement. That it will be only movement of the tip and operating. So there is hardly any shearing force on the abdominal wall and pain. So there is recovery is fast, the surgery is nearly bloodless, and there is not much pain. Robotic surgery after operation patients, they do not need painkillers. And complex surgeries are possible. Some of the surgeries I cannot imagine doing without a robo in the couple of years' time. Even now, some surgeries I don't like to do without a robo. And in time will come, some of the surgery will be done precisely with robot and not by any other means.
What is the cost of the equipment and the cost to the patient for the robotic surgery?
Thank you, Paulumi. Very, very important question. The robot we could not bring to the Northeast. One of the factors was the cost. The robo costs minimum. The cost of the equipment is starting from 11-12 crores to 23-24 crores. The Da Vinci cost us 23-24 crores. So apart from the cost, the training facilities were not there, and that's why I had to conceptualize and start a association of robotic surgeons to train up surgeons across the India and the globe. Because the equipment is costly, patient has to be at some cost. Not only that, the disposables, the instrument we use in one surgery, there is a minimum cost of about 75,000 to 1 lakh involved to the patient. So a surgery which costs you around 1 lakh, you may end up spending nearly 2 lakhs, or if a surgery costs you around 1.5 lakh by keyhole, you may have to spend 2.5 lakh for that, but the recovery is faster. You may be back to work in the next 3, 4, 5, 6 days of walking out of the hospital. And the second is the any surgery which is not possible by other means may be possible robotically. So the cost is basically the cost of the machine, which part of which the patient also bears, and the cost of the disposables which we are used. The earlier robo which we are using, there are about 92 in the country. They are all very expensive, starting from 20 crores to 30 crores. And now the new robos have come, the Versius from CMR, the Hugo from Medtronic. These are all competing with them, and they are slightly different, and they are trying to make it cheaper. But so far, the minimum extra cost is 75,000 to 1 lakh, which the patient has to bear to get the benefits of it.
Sir, why is robotic surgery is not available in other parts of the Northeast?
Robots are very expensive. That is one. Second, you have to train your team. Third, the surgeon also must be very well versed with technology. It's entirely a science of surgery, not an art now. Earlier we used to tie knots very nicely. We used to stitch with the hands. Now we do all with the equipment, instruments. So the equipment is expensive. That's why it is not available. The team needs to be trained. If I am only trained, but if my team doesn't know about the equipment, who will help me? So for us, 9 members of our team are trained in robotic surgery, including the specialist cancer surgeon, Dr. Arindam Barua, urologist, Dr. Hiralal, gynecologist, and all of them, even one assistant surgeon is trained, and plus 4 scrub nurses are all trained abroad outside India in cadaveric labs. So team is not available, equipment is expensive, and these equipments, if you just buy the machine, you cannot survive because it is expensive. That's why it's probably it has not reached in many parts of the Northeast. But I think now newer robots have come which are comparatively cheaper, affordable, and it's going to come. And it's our duty as an association, I'm speaking on behalf of ARIS, Association of Robotic and Innovative Surgeons, to see to it that the surgeons are trained and then take the technology to different parts of the country and the world.
Is there any complications in robotic surgery?
People have a very different notion. They all feel that the machine will be operating and a machine may start behaving abnormally, but it is not the case. All these machines are under our control. Any small movement is my movement only, which is taken up by the machine. And I'm stitching with the robo. Actually, I'm stitching myself, not the robo. So there are anything in any walk of our life, we have complications. Whether we are walking on the street, we might end up with an accident. So surgery is not devoid of complications. There are complications in surgery, in general surgery, endoscopic surgery, robotic surgery, all have their complication. Yes, in the robotic surgery, Till now, we have seen the complications are less compared to, because the dissection is very precise. So far, we have not seen any machine robot related complication as such, because there are so many safety devices. The moment there is small change in the angle, the machine stops on its own. It is an alarm and it stops. So hardly there are any machine related complications, but there can be. The robots are new, we need to study. There can be new things coming up, but so far we have not seen any major complication. No patient should be frightened of any complications occurring due to robotic surgery.
What is the future of surgery as robots have come now?
Future is not uncertain the way we used to think 30 years back or 40 years back or 20 years back. Today we have seen many revolutions. Robots will be there. Many cheaper robots will come. Many Indian versions will come. So there'll be the smaller robot for head and neck surgery. There'll be a robot for abdominal surgery. There might be a robot for pile surgery, which is already, it has come, one of the robots. So many miniature robots will come. There'll be another technologies which will be coming. I might be taking a small nano robo inside into the stomach, and from outside magnetically I'll be able to operate. So nano capsule robots are already there. We are trying to, the researchers are trying to stop inside bleeding with the help of a capsule, and which has a tiny camera inside. Many of the surgeries, open surgery, will be lost to endoscopic surgeons. Many of the operations are done through endoscope nowadays, and many of the endoscopic and laparoscopic surgery will be gone to robotic surgery. So robots will be there in every walk of our life, not only surgery. And robots may have an artificial intelligence in the coming time. If I feed my robot with one particular operation, suppose I feed the robot with a robotic hernia surgery, if I feed 50 cases or 40 cases, robot may be programmed to become autonomous. So I just tell the robot and give indication and just observing. Even I may not be observing. So and robot will do the surgery, will follow all the steps, and whenever it goes out of that step, there will be halt. There will be an alarm, then an audio alarm that no, you have missed this step. So this is one. I feel another thing which we are coming up is a telesurgery and artificial intelligence of the robot, and telesurgery or operating from a remote. It may be so that I'm sitting here and I send my robot to a war zone or to the battlefield, and where the robot can do at least stitching of the wounds of the wounded people in a war. So these are all newer things which are going to come. Today, whatever we think, it happens in the coming years. You have seen the revolution of mobiles from where we have reached. So surgery and surgical technology is not behind that.
What message would you want to give to our viewers?
Dear viewers, thank you for joining. The message which I would like to say is, today many good treatment facilities are available in the Northeast India. You can choose your hospital, your doctor. You can always Google and chat with your doctor. You can always email us or any other hospital of your choice. So you did not go very far away places, because it is very, very difficult going to these places with the family for follow-up. So not only that, many newer techniques and technologies have come, which sometimes you may be totally ignorant. So better study, explore. Many information is there available in the Google world today. Some of them is correct, some of them may not be, but just research it before undergoing any treatment. Today, if any patient for a gallstone surgery undergoes an open surgery, it is just unbelievable. It cannot happen. It should not happen. So like this, so please explore and then look at the affordability, whether you can afford to undergo the treatment or not, and then take a call. Techniques, technologies, surgeries are coming up, and most of them are safe. Otherwise, they would not have come. One more thing which I forgot to tell the viewers, we are also strong in liver diseases of the pancreas. We are the second center in the Northeast for liver transplant. I am thankful to the Government of India and the Government of the state of Assam for giving us a license and permission to
do liver transplants. So this is one thing. Along with the liver, we also have a very strong department of the liver, radiology department. There is a procedure called TIPS, where internally we can bypass the liver in early cases of liver failure. So that is done routinely in our centers. This is one of the procedures which is done very infrequently in the Northeast. Maybe one or two centers might be doing it.
We will soon come with another episode of this health series. For information and queries related to today's talk, you may please contact the following number and the email ID.